Now, the special Air Asia flight AK-8264, designated to bring back dozens of Malaysians, including their family members, is currently making its way to Wuhan with 12 crew members and 8 members of the mission. In a statement, Deputy Prime Minister Datuk Seri Dr. Wan Azizah Wan Ismail said the plane took off from KLIA-2 at 3:50 p.m., transporting with it 500,000 pairs of gloves to contribute to the Chinese government's fight against the novel coronavirus. The Deputy Premier, who's also the Central Disaster Management Committee chairman, said all evacuees will be required to go through a health screening at the Wuhan Tianhe International Airport before boarding the plane. Upon arrival at KLIA, all on board, including the mission members and crew, will be screened again at the Air Disaster Unit away from the general public. Those showing symptoms will be immediately taken to the hospital, while the rest will be taken by bus to a monitoring centre to be quarantined for 14 days. The National Disaster Management Agency will inform their families in Malaysia on the flight details, health screening and quarantine period. Meanwhile, 1 million pieces of latex gloves would be received by the Hubei Charity Federation, a Chinese government-designated donation recipient that would distribute the medical glove supply to healthcare facilities in Wuhan. The next batch of 1 million medical gloves is scheduled to be delivered this Wednesday. Meanwhile, the evacuation process of Malaysians in Wuhan is underway as the Malaysian embassy is in the final stages of preparing to gather all the identified Malaysians to be brought home today. Malaysian ambassador to China, Raja Datuk Nur Shirwan Zainal Abidin, said the secretariat team for the mission was working to ensure everything, particularly the coordination of logistics at Wuhan Tianhe International Airport, would proceed smoothly. Of the final list of 141 people, 24 are non-citizens, comprising of spouses and children. They have been informed to gather at one place and will be taken to the airport by specially prepared vehicles. The names of those on the list have been submitted to the Chinese government yesterday. Now, hotel operators around the country are losing millions of ringgit due to booking cancellations following fears of the coronavirus outbreak since January. According to the Malaysian Association of Tour and Travel Agents, MATA, tourism players in neighbouring countries are equally impacted. As such, its Honorary Secretary General, Nigel Wong, said more than 20 million ringgit is urgently needed to help the industry weather the storm.
So what we are hoping for from the ministry, besides any of the other exemptions and subsidies that the minister may see fit to give to us, is of course funds for strategic marketing, because we believe that the industry itself, tens of thousands of tourism industry players who reach countless markets individually, will be the best channel from which to spread the image of Malaysia as a safe and viable destination to travel to.
The areas that need to be looked into are fuel subsidy for the transportation operators, tax incentives, as well as incentives for travel agencies in bringing foreign tourists to Malaysia. Currently, hotel operators are facing decline in occupancy rate between 30 and 60%. Finance Minister Lim Guan Eng recently announced that the government is ready to launch an economic stimulus package to curb the impact of the outbreak towards Malaysia's economic growth. A Malaysian was among 15 travellers who were refused entry into Singapore in the 13 hours since travel restrictions kicked in for those who have visited China. The restrictions took effect at 11:59 p.m. on Saturday, and the Immigration and Checkpoints Authority (ICA) said that 15 have been rejected as of 1 p.m. on Sunday. According to the ICA, The other travelers who were refused entry into the country comprise one Spanish citizen, one British citizen, 2 Americans, 5 Indian nationals, and 5 Chinese nationals. They were refused entry due to their travel history to mainland China in the last 14 days or because of suspension of visa facilities. The ICA said that the travel restrictions do not apply to Chinese nationals who are already in Singapore. As of Saturday, it has approved more than 50 applications from Chinese passport holders to extend their social visit passes since the announcement of suspensions of new visas on Friday. The number of coronavirus deaths in mainland China has overtaken the 2003 severe acute respiratory syndrome epidemic in the country. More than 361 people have died of the disease in China, and the number of confirmed coronavirus cases stood at 17,205.
Over 8,000 medical workers have been deployed to China's Hubei province, many of whom have experience working in the 2003 SARS outbreak. They include some of the finest respiratory, infection and intensive care experts. Clinical trials of drugs are still underway to combat the novel coronavirus, with the treatment protocol for containing the virus yet to be established. In the meantime, Chinese community officials are appealing to its citizens not to go outdoors to minimize the spread of the virus in a variety of innovative ways, including deploying patrol drones, speakers, and short videos. Beijing railway station remained largely empty on Monday as China ended its extended Spring Festival holiday amid the novel coronavirus outbreak. Travelers arriving at the station are worried about contracting the virus during their commute. With much of China's economic heartland still closed, concerns are growing over the impact to the Chinese economy. The Shanghai and Shenzhen stock markets, which have been closed since January 24th, plunged by around 10% on opening Monday. So far, more than 175 cases have been reported outside of China. The United States confirmed its 11th case on Sunday as it plans a handful more flights to bring Americans home from the virus-hit Hubei province.
Now, Hong Kong announced it was closing all but 2 land crossings with the Chinese mainland on Monday to slow the spread of the deadly new coronavirus as medics staged strikes calling for the border to be completely sealed. The semi-autonomous financial centre has 15 confirmed cases of the disease, most brought from the mainland where the epidemic began. It has suspended cross-border rail and ferry services, but health workers want a total border closure, claiming that without doing so, manpower, protective equipment and isolation rooms would not suffice. The union said frontline workers, including doctors and nurses, would follow on Tuesday if their demands were not met. However, authorities say closing the border would completely go against the advice from the World Health Organization. The border in Hong Kong functions in much the same way as a normal international checkpoint. As well as transportation closures, China has also stopped issuing visas for individual travelers to Hong Kong. Meanwhile, one of the 2 new makeshift hospitals in Wuhan dedicated to treat coronavirus patients have opened its doors on Monday. Construction work started on the Huo-Shenshan Hospital on January 23rd, and the project was finished just 8 days later.
The emergency hospital replicates Beijing's SARS treatment model that was built during the 2003 epidemic. Engineers were brought in from across the country in order to complete the construction in such a short time. More than 1,500 construction workers and 300 machines were involved in the construction of the hospital. A time-lapse video shows the scale and speed of construction as workers work through the night to install quarantine wards and hospital bays. The Huo-Shenshan Hospital has an area of 25,000 square meters and is built with prefabricated buildings. With a capacity of 1,000 beds, the hospital will also staff around 1,400 military medics. Chinese authorities are building a second emergency hospital 25 miles away from Huoshenshan Hospital called Leishenshan. The second emergency hospital will have a capacity of 1,600 beds and is expected to be open on Wednesday.